drastically improve your quality of life, letting you laugh and smile with confidence. Dr. David A. Hirsh from Springfield joins us to tell you more about this dental option. Now, prior to mini dental implants, there were just plain old implants. Tell us what that procedure was like.
The procedure for traditional implants was a multi-phased procedure, where on the first step would be to do a surgical procedure to open up the gum tissue and place a rather large hole in the bone, which I'd like to demonstrate.
Yes. So that's the size hole for a regular implant.
That is the size hole for a traditional implant. Then the gums would be stitched over. The patient would have to wait anywhere from 4 to 6 months for the bone to merge with the implant. A second surgical procedure would be accomplished to uncover the implant, and then impressions would be made to use the implant for whatever it was going to be used for, either a crown or a denture or so on. That was a 6 to 8 month procedure, start to finish, 2 surgeries involved, removing a substantial amount of bone per implant, and a fairly costly procedure.
Right, and pretty invasive, like you said, it does take some time.
And that was a reason that many patients didn't proceed with treatment because of all that was involved, including the cost.
Absolutely.
Now, mini dental implants came about as an answer to patients' needs who wanted to accomplish something but really didn't want to go through an implant procedure. And just to show you the size of the hole compared to the traditional, that tiny little hole in the bottom is the pilot hole that would be used for a mini implant.
That's unbelievable, the difference in the size.
It's a tremendous difference. In the mini implant procedure, to contrast it with the traditional, an impression would be made on the first visit. Nothing else would be done that first visit. Patient would return 3 or 4 weeks later, and everything would be ready to be done for them, and they would leave with a mini implant and a crown in place, ready to be used that evening.
That is amazing, and it's actually more than half of the cost.
Less than half of the cost to do that, no less invasive, and even patients that are on Coumadin, blood thinners, where there's a lot of precaution with traditional implants because it's a surgery. It could be done without a patient coming off Coumadin, because all you're doing is drilling a very small pilot hole into the bone, the size of the hole I showed you, and then the implant is then screwed in, very much like screwing in a tiny screw into a piece of wood. It's already part of the jawbone at that moment. A crown can be placed that day, and
wow, that can change your life. That can absolutely make your life better, it seems, just by something as simple as that.
It is very simple.
Really?
It is very
so you
simple.
have some models to show exactly how it works.
I do. The original impetus for mini implants was the traditional denture patient who was wearing a lower denture and really was uncomfortable. It was moving around, couldn't chew very well, and also had embarrassment with family and friends that the denture would slip, would load it with a lot of paste or powder, and they would taste the paste and powder with their dinner. Today, that patient can come in, have an impression taken, come back 3 weeks later or so, spend 1 hour in the office, be numbed, of course, have 4 mini dental implants placed, then some rubberized attachments within the denture.
And it goes right on?
It goes right on, and it snaps in. So now this denture patient can go out to dinner, feel comfortable chewing everything, have corn in the cob rather than corn.
Right, so it makes
cream corn.
A big difference, yeah.
Apples instead of applesauce.
Yes.
And they have a comfort level that they feel that they can now do what they once did.
And quickly too, because we're almost out of time, Dr. Hirsh, but I think what I learned so much from you, that a lot of the taste receptors are on the top
the palate, yes,
of
on
your,
the palate.
the roof of your mouth.
An upper denture can be fabricated with mini implants so that the palate could be removed, and then they can taste the food much better without paste, and food receptors are now uncovered.
And let's show an example quickly of just the front tooth right here that we have here as well.
This is done now for front teeth also. This is a mini implant.
That's so simple to do.
It comes back with the crown, and the crown then goes over.
And you can't even
cemented
tell.
in. And this is a half-hour procedure in the office.
Unbelievable. We've got about 30 seconds, but really quickly, you have a case that you can show that you're working on right now.
This case will
just
go
to
in
show how
this Tuesday. Okay. This is the actual model. A surgical stent or guide is placed so that there's no mistake in the angle of placing the implant. Okay. And the crown is actually ready to go in for this woman. She will come in. The implant will be placed, and this particular crown will go in, and she will no longer have to wear a removable device.
That looks like it really is life-changing,
And that's a perfect
Dr. Hirsh.
shade for her other teeth. This will blend in, and nobody will know that she has an implant tooth.
And most importantly, she's more confident. She feels better. Her life is better because of how she feels. And I think that's fantastic. And quickly, we're out of time, but just so everyone knows, don't have to leave your own dentist. They can come see you for mini dental implants and still go to their current dentist.
If they're their current dentist, they should ask if mini implants are available. If they're not available, we'll be glad to see them on a referral basis, and then of course return them to their general dentist for their ongoing care.
Wonderful. Well, thanks so much, Dr. Hirsh, for being here. It was great,
for having me.
Great learning about this.
Wonderful.
And if you would like more information on mini dental implants and how Dr. Hirsh can help you with your dental health, just log on to smilesforfriends.com. You can also call them at 413-734-9089.